When we think about dementia, we think about that person that we love so much, losing their memories and slowly losing their own personality and losing the way that they are. We lose the person that we love while they're still alive. But did you know that there are several causes of reversible dementia? And if we are able to diagnose that early, we can actually reverse that condition and the person goes back to be just as they were before. So in this video, I will talk about this and I hope you like this content. And if you do, please give it a thumbs up and subscribe. Now let's go. Around 15 to 19% of dementia are actually reversible. They are due to conditions that can be reversed. And the way that we have to diagnose that fast, because the faster we are able to diagnose that condition, the faster we are able to treat and reverse that dementia. One of the major causes of reversible dementia is depression. And it is very common in older people to be depressed, to have this medical condition, which is depression. And sometimes they live alone. Sometimes they lost people that they love so much, their partners for their whole lives, and they feel depressed. So depression is one of the most important things that we have to consider when we are trying to diagnose dementia and to differentiate dementia and depression. Usually, the person who is depressed, they feel like their mind is not the same. They feel like, oh, I'm not remembering things. It's kind of foggy. Whereas the person who has dementia, they don't have this kind of self-awareness. Also, medication. And this is so important, especially in older people, because usually older people take a lot of different medications. So this is a very important subject. And because it's so important, I will talk about it in a separate video. But what you should know is that there are medications that can mimic, that they can pretend that they are dementia. And if we remove those medications, we can reverse those symptoms. Another thing that's very important is your thyroid. So your thyroid gland, is it working fine? And if to know that, we need to do some blood exams, some blood tests, because when the thyroid is not working properly, it can also mimic these dementia symptoms. Another thing that's very important and that we always have to check is vitamin B deficiency. And this is something major because it's very common and it can cause symptoms that are just like symptoms of dementia. So whenever the doctor suspects of dementia, he or she will order some blood tests. And in those blood tests, one of those will be to measure vitamin B12 and also B1, which I'll be talking a little bit. Okay, so this one here, when I was doing my internship, I had a patient who had this syndrome, which is called normal pressure hydrocephalus. Basically, what's happening here is that your brain, it's accumulating a lot of water inside of it. And that causes this triad, this three main symptoms that we say, which is wet, wobbly, and wacky. So wet, because the person who's having this disease, they tend to lose their urinary control. So they pee without having control of it. And also wobbly, which means their gait, they're walking strangely. Usually it's like if their feet were too heavy and were stuck to the ground. And also wacky, which is this sometimes hallucinations and losing memory. So these three things, we have to pay attention to it because it could be a reversible cause of dementia. And in this specific case, the treatment is a surgery to drain all this water that's inside of your brain. Another thing that may cause symptoms similar to dementia and that we may diagnose as dementia, but it's actually reversible, it's infections. So two main infections that we have to say here, it's neurosyphilis and HIV. So don't mind if your doctor asks for your 80-year-old grandma for some syphilis and HIV exams because he's thinking about these causes here and it's very important. Another thing to think about is alcohol toxicity. So if the person drinks a lot, that also can cause symptoms like dementia, and the lack of vitamin B1, which we call thiamine, it can cause this kind of symptoms. And if we treat early, it can be reversed. If we take too long, chances that it will be reversed are much less likely. Another thing that's very important here is things that may occupy space inside of your head. So here we have two main things that we are concerned about is that when another person bumps their head, even if it's a minor bump, it can cause tears in their veins, which can cause the blood to leak and cause this expanding lesions inside of your brain. Another thing also is some benign tumor from close to your brain, which will grow and it will also mimic the symptoms of dementia. Another thing that's very important to consider is delirium. Now, delirium is a confusion that's usually linked to an infection, very commonly to urinary tract infection. So if your grandma has an urinary tract infection and she starts to be very confused, especially during the night. So that's one characteristic that we have to be aware of because it's usually get worse during the night. It could be an infection, it could be delirium, and you may think it's dementia, but no, it's delirium. So what will your doctor do to diagnose these reversible causes of dementia? Because if we catch that early, we can treat that and we can actually reverse. Your doctor is going to order some blood tests, and especially here we say a TSH, which is to see the thyroid function, also vitamins B12, the complete metabolic panel, and also to check the infections, as I mentioned before, especially HIV and syphilis. Besides that, he or she will order a brain MRI because there are some lesions that we see in our brains that we'll only see with an MRI. For example, that normal pressure hydrocephalus that I mentioned, and also those expanding lesions like a benign tumor, you will see those with an MRI. So basically, always think about depression, always think about medication, always think about thyroid, always think about normal pressure hydrocephalus, NPH. I know it's a strange name, but it's very important to think about it. Always think about infection, toxins, and structural damages like an expanding lesion in your brain. So those are the main things that we need to think about to actually look and see, okay, maybe this can be reversed. Maybe it's not dementia. Maybe it has a secondary cause that we can actually, if we don't miss that open door, we can treat that person and restore their lives. And that's very important. That is something amazing that we can do as doctors and as patients and as families. We always need to be aware to help the health team to try to diagnose those conditions. I hope you enjoyed this video and see you at your next appointment.